Hello, everyone. Welcome and thank you for making the time to join our webinar today. This webinar is the first of 3 webinars that FIP is hosting throughout the month of October as part of the digital events series, The Role of Pharmacists in the Care of Older Persons. As a quick background, the United Nations established the first day of October each year to be dedicated to celebrating the International Day of Older Persons to raise awareness about the challenges and opportunities of aging. This year's theme advocates for healthy and inclusive aging, and as pharmacists, obviously, we have a very important and growing role in promoting health, independence, and quality of life for older persons. So in today's webinar, we are very happy to be joined by global experts who will share with us strategies from the World Health Organization and will talk to us about preventive approaches to healthy aging and, of course, the evolving and important role of community pharmacists in meeting the needs of aging populations globally. But first, let me introduce myself. I'm Sherif Guorgui. I'm a pharmacist from Canada and the president of the community pharmacy section of FIP. It is my pleasure to be your moderator for the webinar today. And also with me from FIP today are Inesh Nunes Takuna and Albena Labib. They are doing all the important work in the background to make sure that everything goes smoothly and that you enjoy this learning experience with us today. Before we start, we have a few housekeeping points. Please note that this event is being live streamed on FIP YouTube channel, and it is also being recorded. The recording will be available afterwards on our website at events.fip.org and on YouTube as well. If you're joining us live, we welcome your engagement, so please feel free to send us any questions that you may have through the question box. We will first go through all the presentations, and then we will open the floor for discussion with our panelists, and that's when I will get to your questions, and we'll certainly do our best to make sure that all of your questions are addressed. We also very much value your feedback. That's very important for us to hear from you. So if you wish to provide any comments on this event in particular or on our digital events in general, please send your comments to our email at webinars@fip.org. It's important for us to not only know what we're doing right, but also to know what we can improve on. So your comments and feedback are very valuable, and they're always welcome. And of course, if you're not a current member of FIP, I would like to invite you to become a member. It's a great opportunity to join a global network of colleagues from all over the world and to benefit from all the tools and resources that FIP offers. So if you'd like to learn more about the membership benefits and to become a member, please check our website at fip.org. And if you prefer to follow along today with translated captions in your preferred language, you can do that with the live translation feature on Zoom. You can try it out. It's very straightforward. The instructions are on the slide here. You can click on closed captions icon, enable the translation toggle, and just choose your preferred language. And this webinar was developed in collaboration with the International Association of Gerontology and Geriatrics, and FIP would like to acknowledge and thank them for this very important collaboration. So thank you so much. We have a panel of fantastic speakers today. I will be introducing each of them more properly in just a minute before their individual presentations. But I just wanted to take this opportunity now to thank them for taking the time to prepare the presentations and for being with us here today to share their valuable insights and expertise on this topic. For our program today, we will be discussing the global challenge of aging and the WHO strategy 2026-2030, the new definition of healthy aging and updated preventive strategies, We will also discuss how community pharmacists can better support older persons and the usefulness of the e-trigger program for pharmacists. So by the end of the webinar today, we will be able to describe the updated definition of healthy aging. We'll understand the global trends, challenges, and opportunities associated with population aging, and identify effective approaches for pharmacists when supporting older people, including strategies to strengthen pharmacy services for aging populations. And we will also learn about tools such as the e-trigger program and its value to healthcare professionals who work particularly with older adults in their daily practice. So with that, it is now my pleasure to introduce our first speaker, Dr. Yongjie Yan. Dr. Yan is a technical lead for the Aging and Health Unit and the WHO Regional Office for Europe in Copenhagen, Denmark. He was a doctoral fellow with the Social Science and Humanities Research Council of Canada and received his PhD in gerontology from the University of Southern California in the United States. Prior to WHO, Dr. Yan worked for the Government of Canada on aging policies. Dr. Yan, thank you for being with us today, and I will now turn it over to you.
Thank you so much, dear Sherif, and good morning, good afternoon, good evening, everybody. Thank you so much. Just give me a second. Thank you so much for the invitations on such a very important day, on the UN Day for older persons. And I think it is today that we can really take this reflection to think about the older people who have enriched our life, but also to take a moment to reflect the kind of world we want to create for our future self, our future older selves. And so I'm really pleased to have this opportunity to speak about the WHO approach, the WHO European approach in addressing healthy aging. We are in the process to develop a strategy on healthy aging to promote a lifetime of health and well-being in our region, which consists of 53 countries. And so I'm pleased to share a little bit about what we are doing, and of course, looking forward to further engagement as we develop and finalize these strategies. And I think amongst this, I'm really looking forward to have this discussion with you and also to listen to your thoughts about how we can work better together with you as pharmacists, because you play a very important role to not only promote the well-being, but also to make healthy aging a reality. So I think we all know this trend of population aging, but for us, the WHO European region, the 53 countries, we're no longer an aging society, we're an age society, because last year we've sort of crossed a milestone where there are more older persons than younger children and adolescents in our region. And I think this is something to celebrate, of course, because of our public health achievement. But I think with longer life expectancy, we need to ensure that this is also a healthier life expectancy as well. And so I think without taking the actions, the gap between the health and care will only widen, and the gap between life expectancy and healthy life expectancy will widen as well. And I think part of this narrative, which collectively we need to change, is changing the way we talk about age and aging, and that we don't see older persons as simply recipient of care, but they are vital. Perhaps not they, we are vital, because we are also aging, but vital members of our communities. So I know that Professor Jean-Pierre will speak a little bit more about the WHO definitions of what healthy aging means. And I just quickly sort of talk about our definitions and go straight to what are the actions that we're proposing. So, of course, we define healthy aging as the process to develop and to maintain functional abilities that enable well-being in older years. And functional abilities is what enable all of us to do what we value, whether it's prepare a meal, meeting a friend, pursuing a hobby, having your second, third, fourth, fifth career, or simply going about to your daily living and visiting local shops. One example I can give you when I was visiting the Netherlands last year, is meeting with our partners in the nursing home. And I spoke to our CEO, and he says, my wish is not to have a nursing home anymore, and that nursing home is for people with dementia. And I was curious, and I asked, why is that? What he says really shocked me or touched me. And he says that, what he wants is really making sure that he provides support to the people. And one of the person is living with dementia who says that, his dream is to able to do his own grocery shopping. So the whole team and whole staff was supporting him to build this functional abilities. And of course, this older person was able to do just that. And I think this is what healthy aging is, what we can do to support functional abilities and how we can create a supportive environment. And so it really depends on two things: the intrinsic capacities, which is the physical and mental capacity that any one of us can draw from any time, but also the environment. And I think it's the interactions between the intrinsic capacities and the environment that determine how well we can function in the communities, to the extent that if the environment is not able to support a person, then that's where disability comes in. So if there is one message I hope that you will take away with you today, is this: aging is living. It is not a problem to be solved or a disease to be managed. And it is a privilege to be able to live longer. And it should be filled with purpose, connections, and dignity. And it depends on the choices that we make, the environment that we create for ourselves and for each other. And it is a journey very much shaped by choices that we made today as individuals, but as a community and as a society. So we have a bit of a timeline in the development of this European strategies. Throughout this year, we have been having many consultations, stakeholder engagement, including FIB, and hearing what it is that are most important and what actions we can take. And of course, working together with government at the national, local level about what are the actions that are concrete and actionable. And of course, working with our scientific and research partners on the evidence, what are key to improve healthy aging. And so later this month, at the end of this month, we will have our regional committee meeting with our 53 member states, where healthy aging is one of the topic of discussion. And next year, we will have we'll present a draft strategy of what we have heard, and to begin our formal consultations with the goal of adoption at our regional committee in 2026. So just a little bit more information of the stakeholder engagement that throughout this year, we have had many consultations, public hearings, meeting with member states, with public health networks, civil societies, seniors organizations, subnational and local authorities, because we must not forget about local government where implementations happens. And we consulted over 1,700 individuals. And those informations are available now on what we have heard, and we are happy to share that. And of course, we've also conducted a survey to countries at the national and subnational levels, where we met with 81% of our countries. 43 out of 53 member states have participated in the survey, prioritizing what actions are most needed. And of course, engaging with close to 170 cities and communities in our regions that represents 22 countries. And of course, using the Global Burden of Diseases data, the Institute of Health Metrics and Evaluation database, creating data profiles for all 53 countries and longitudinal data, and looking at equities to help guide the discussions and the selections of actions. So this is what we have. We have 4 core action areas about prioritizing prevention, to look at how we can transform our health and care systems to supportive, enabling environment, and to challenge ageism. We've also identified some of the key enablers that would enable this implementations. We need strong leadership across government, across societies, and working together with partners. We need to make strategic investments where working with our research partners are very key. We need to think about innovations in the digital era. How can we do better? We need to build capacities, and what gets measured gets prioritized. And so we need to strengthen data and evidence in this area. So prevention is one of the cornerstones for healthy aging, of course, taking a life course perspective. Here you see a very short video, which you're very welcome to scan. This is an example from Portugal. Maria, you see on the screen, she's part of the walking football club. And the idea is quite simple, no running, just walking. And through this initiative, she lost weight, she got her diabetes under control, and really improved her mental health because she's out in the communities. And she said, this is life-changing for me. And it really shows how prevention, even at the local level, as simple as a community, a club, walking football club can transform communities, and having a system to support this. As we develop this strategy, we're looking into possible actions together with our member states, what actions we need to take under these action areas of making preventative services like screening, vaccinations, early diagnosis accessible to all, and ensuring that we reach to the underserved populations, whether it's through digital tools, outreach, perhaps working very closely with pharmacists about how do we reach the most vulnerable. And of course, embedding mental and brain health in part of the prevention, strengthening awareness on risk reductions for dementia, and across all of this, strengthen primary health care, which is the backbone to preventions, the continuity of care, and connections to community support. The second area of action is transforming our care system to ensure dignity and independence at every age. Here you also see a picture of Sebastiano. He's turning 107 next month, and you can scan and you can watch a very short 2-minute video about his life and his lessons learned for longevity. And his life show what is possible with healthy habits, with good social ties, and a very supportive care system. And it reminds us that dignity and independence can be sustained at every age. And for this strategy, some possible actions that we're finalizing is about creating integrated person-centered care and pathways that combine not just about care, but health promotions, rehabilitations, long-term care, palliative care, and to expand these age-friendly community centers that bring the health and care sectors together while fostering connections, because social connections are key to healthy aging. Addressing from prevention to chronic disease management to end-of-life care. And so what transforming our care system means is building a system that are coordinated, community-based, and centered around people's need. And so for the third and fourth action areas about supportive environment and challenging ageism, here, this is a picture of one of our age-friendly cities and communities in Sweden, the city of Gothenburg, where older persons are involved in the cities. They call themselves future developers because they work together with the cities to design the cities to be more age-friendly, not just for themselves, but for all ages. And by them taking actions, they are demonstrating the value of older people in our communities. Actions within these areas about how do we advocate for age-friendly infrastructure, from accessible housing to transportations to digital technologies, to ensure mobility, independence, and participation, meaningful participation. So it also means how do we expand community-based programs that promote, for example, physical activities, balance, and strength that help people to stay mobile and reduce the risk of falls. And so having this enabling environment, they don't just support health, they really do foster inclusion, respect, and equity. So I wanted to share some of the few age-friendly practices from our global network of age-friendly cities and communities, pharmacies are most accessible part of our health system, and they are a trusted place in our communities. And when we look at supportive environment for healthy aging, pharmacists plays this crucial role as community anchors, as innovators in safety and design. So what you see examples from Cardiff in the United Kingdom, pharmacies are part of the community to create a dementia-friendly practices in having a welcoming spaces for people with dementia. Or in Spain, where pharmacists act as a community connectors to spot isolations to link older persons to support. Or in Hong Kong, in China, telemedicines allow pharmacists to reach to those who are unable to visit physically and to break down barriers of distance and disabilities. So these examples shows how pharmacists strengthen both physical and digital communities. Other examples, pharmacists are involved in design of safer system. For example, in Belgium, they distributed a fridge boxes with vital health information for older people. Or in China, in Guangzhou, really co-developing and redesigning this together with older persons themselves on medications label and reminders app, as well as in Canada, about safe disposal of sharps and needles in local pharmacies. And so these are just a few examples. And of course, we, as part of the global network of age-friendly cities and communities, we have a database of over 2,000 now of practices that you can search, that you can type in, and you can have a list of cities and communities, what programs they have done and whether they are evaluated, and how you can contact them and share the practices. So I wanted to end here by talking about examples of Maria from Portugal and Sebastiano in Italy. It shows that prevention changed life, and Sebastiano's story shows how dignity and independence can be sustained into the very oldest of age. And these are not just stories of aging, these are stories of living. And I hope that as we develop these strategies, we can make this a reality for all of us as we build this movement of healthy aging across the European region. Thank you.
Thank you so much, Dr. Yan, for this very informative presentation. I would like to now introduce our next speaker, Dr. Michel Jean-Pierre. Dr. Jean-Pierre is an emeritus professor of medicine at Geneva Medical University and an honorary professor of medicine at Limoges University in France, Beijing University Hospital in China, and an adjunct professor at McGill University in Canada. He co-founded the European, Asian, Latin American, and Middle Eastern Academy for Medicine of Aging. He serves as the director of the IAGG World Federation of Geriatric Education. In this role, he established e-Trigger across 3 time zones over the span of 4 years in 2021, 2023, and 2025. He was the president of the European Geriatric Medicine Society and has been appointed WHO expert for the Aging and Life Course program since 1992. He is a full board member of the French National Academy of Medicine in Paris and a foreign correspondent for the Real Academia de Medicina de España. He received numerous international lifetime achievement awards in 1998, 2002, 2013, and 2025, including the inaugural Lifetime Achievement Award of the European Geriatric Medicine Society. He has authored over 500 peer-reviewed scientific papers and co-authored the first global WHO report on aging and health, and is also the first editor of the Oxford Textbook of Geriatric Medicine and the European Academy's report on transforming the future of aging. Dr. Jean-Pierre, thank you so much for being with us today, and I will now turn it over to you.
Thank you very much for your introduction. Very nice introduction, and too long probably because I am old and I'm pleased to be with you today. It's a fantastic day. So firstly, I would like to remember you that the aging process is dynamic, complex, and inescapable. It starts at conception and finishes too often, too late, at the old age in disabled state. Apart from hazard and chance, as said before, the aging process there is depending of two main components, the individual characteristic and the life environment. As the individual characteristic, you need to know and to remind you that in fact only 25% of our genes have a fixed expression all over our life. That is to say that 75% of our genes have a modifiable expression all over our life. And what is very important to consider, and we are living in a life environment with a diversity of nature, biodiversity, pollution, country characteristics, country economics, culture, spirituality, social and social background. So this complex interaction between individual characteristics and life environment results in different kind of mechanism, very complex, very intimate, and which define the biological age and the chronological age. And one thing which is very important between in this complex overview is in fact that we have also to think about epigenetics. And this epigenetics is fundamental to determine our educational attainment, our nutritional habits, our physical activity performance, our choice of lifestyle and life behavior. And all these factors intervene in determining what is or not healthy aging. So what is really healthy aging? There is a very old definition, which is in fact to live as long as possible without illness, pain, and without physical and intellectual deterioration. And in fact, when you are looking at the causes of death in 2040, I go ahead in time, you have to say that the main cause of death are probably cardiometabolic disorders with neuro and cardiovascular diseases and metabolic disease as diabetes. You have also the problem of chronic lung disease and also infection, which are very important to notice. We have also Alzheimer's disease, indeed, and a lot of different kind of cancers. So this is an old definition. Now we have a new definition, which was defined in 2015 by the WHO report, and it was already said by our previous speaker. The healthy aging is a process of developing and maintaining functional capacities that enable well-being in old age. This definition is very important because it brings a new idea, which is the idea of functional aging. And when we are speaking about functional aging, you have to know that everyone is living differently and aging differently. And at the same age, you can have very healthy old adults, but at the same time, at the same age, you can have disabled old people. And in fact, it is very important to understand that this kind of disability is something that occurs mainly between the age of 75, 80, but also it links to different causes. And we have five main causes of functional disabilities in old adults over the age of 65. Mobility disorders as sarcopenia, osteoporosis, and frailty. Sensory impairment, very important, balance, hearing, vision. Poor mental health, loneliness, solitude, depression. Cognitive decline, delirium and dementia, and chronic disease, as mentioned before, cardiovascular, metabolic disorders, and indeed cancer. And when we are looking at the time span in disability, we are very impressed by the fact that they are very different from one country to the other country. And as you can see in France, old women spend around 20 years of their time in a disabled state. And we have to know that the people who are less wealthy suffer from a triple disadvantages. They live shorter, they are dependent early in life, and they live longer with disability. So we have to try to fight against these disabilities, and it is very important to take into account the functional aging all along throughout the life course trajectory, and to try to to understand it. WHO, within this report in 2015, differentiates the intrinsic capacity, which are the capacities that all of us has, e.g., physical, mental, cognitive, sensorial capacities that all we have and we belong to us, but we are living in one environment, and within this environment, we have to define how intrinsic capacity and the environment are interacting, and we call it the functional ability. So if we like to live longer and in good health, we have firstly to have a development and the maintaining of the intrinsic capacity. We have also to do things that are important for us, and among the things that are the most important for us, it is in fact to stay independent until the end of life. And we have to try to understand how this process can be the best possible. And a lot of consideration has to be considered. The first one, which are something very, very important, is to favor healthy and safe living environments. It is to reduce socio-economic inequities, and also, for me, fundamental, enhance basic education. During the young age, you have also to enable all children and young adults to maximize their intrinsic capacity. And health education, but also health literacy, is fundamental. A third point, which is important to consider, is to advocate for professional learning, fair employment for all, and flexible retirement time. For me, this first part of life, on which I cannot insist too much, is really fundamental. This is one of the key issues of how you will age later. The second part of life, which is fundamental, is in fact the midlife. And at midlife, the first thing that you have to do is to adapt lifestyle and good lifestyle and life behavior. And in this way, I would like to show you this study, which is a prospective study of 8 years concerning more than 3,000 participants at the age of 63 when they are included in the study. And you can see that the healthier people have always remained active all over their life. But in fact, if they stop being active, they decrease their healthy aging. If, at the contrary, people who were inactive until the age of 63 start to be active, in fact, they gain in healthy aging and healthy capacity and functional ability, which is very important. Another extremely important study concerning more than 1,000 participants coming from more than 20 countries were followed during the age of 12 years. And during this follow-up of 12 years, they consider 4 criteria: a body mass index, 23 kilogram per meter square, physical activities more than 1.5 hours, leisure time more than 2.5 hours and per week, and no smoking. And if we are considering only having these 3 of these 4 criteria, you can see that you can increase your life expectancy without chronic disease by about 10 years for men and for women. And at the same time, you decrease a lot of disease as cardio, neurovascular disease, metabolic disease, cancer, and lung disease, which is fantastic to know how it was possible to show that life behavior can completely change your outcomes, health outcome. And what is important to add is that healthy nutrition and immunization are very important to complete what I just said now. So it is important at midlife to adopt healthy lifestyle and behavior, but also it is important to prevent at midlife chronic diseases and age-related disabilities. And which we have to know that in fact the biological aging drive to a lot of have a lot of consequences and disease, and these are particularly mobility disorders, sarcopenia, osteoarthritis, frailty. You have also, unfortunately, cardiovascular aging and a lot of cardiovascular diseases. You have also neurovascular and neurodegenerative disease, and you have also a lot of cancer. And with the advance in age, you have the accumulation of disease. And you can see that this accumulation of disease is very important. And at the age of 70, you have 3 to 4 diseases. And these diseases imply polypharmacies and increased disabilities. So you need to do something to fight against this kind of problems, and you can avoid this problem by having maintenance of your physical activities all along your life. You can have an healthy nutrition. You can have maintain your cardiometabolic health. You have to be able to have a great mental and sensory health, and very important, particularly for communication. You need also to have at the midlife cancer screening, and indeed we have not to forget the mouth and lung health, and also vaccination, which are very, very important also at midlife and which are too often forgotten. So after that, you have to think to assure full equitable access to integrated social and health care. And this means that if you, for example, for physical activities, I show you the study before, but you can see that if you are moderately active or intensely active, which is in gray and green, you can see that you decrease the incidence of chronic disease, you decrease your depressive symptom, you decrease your impairment in gait, you decrease your inabilities in daily living, and also you modify and decrease your cognitive impairment. And we have to know that these cognitive impairments are linked to a lot of factors which are modifiable. Among these factors, you have low education, sedentary lifestyle, midlife obesity, smoking at midlife, hypertension, diabetes, and midlife depression. All these factors were now completed by other factors such as hearing impairment, hypercholesterolemia, late onset of atrial fibrillation, and chronic kidney disease. And all these factors are in fact preventable because they are cardio, neuro, and renal vascular risk factors. And by fighting against these risk factors, you decrease your chance of getting any dementia. So to be optimistic, you have to know that the notion of brain reserve, which was an idea from Snowdown studying a community of nurses, that people with higher brain reserve can cope better with brain damage and for a longer time. That is to say that people who have a high education have less incidental dementia. People who have a high complex occupation also decrease their chance of having once a dementia. However, we have a new challenge, and this new challenge is the digital literacy. And this very wide overview done in 2021 in Europe shows that people who are aged over 65 have a lot of problem with digital literacy and illiteracy illiteracy in digital health. And so education is linked also to this digital literacy. So when you have low digital literacy, you have decreased access to health literacy, you have problems to use digital health, you delayed your early intervention, you have difficulties to manage your chronic disease, and indeed these problems with health literacy increase your health inequities. So I think that it is very important to think of this point, but also to have, during the late part of life, a sustained functional independence and encourage aging in place until death. And to do it, what you need to do is to have an age-friendly community, which a social network and social connection, and to increase them as you are aging. You need to have good transportation, allowing you to go where you want, when you want, to have a good clinical care at home, and to have also, and it is very important, to have accommodation of your living place to be able to stay at home as long as possible. And I think that more and more you are speaking about smart home, and technology can be everywhere. You have a lot of system, but what is important, and this system has to be to help you to be more secure, to be more safe, to be independent, and to have better communication, your friend with your families. And indeed, we cannot escape speaking about companion robots, which will come very soon in our daily practice. But I think that this problem, these robots are raising problem of intimacy, acceptability, and ethical issue. And I think that when we are looking at the role of pharmacists within this kind of long life process, the pharmacist has already a lot of work to do by planning individual care, by having medication management, by supporting chronic disease, by medication reviews, but also linking between patient and the various components of the healthcare system. But much more than now, pharmacists can be engaged and need to be engaged as educator and empower the whole adult. They have to increase the health literacy of the patients. They have to help them to get more literacy in digital health, and they have to also promote their self-care. But pharmacists has a role to have an health promotion and preventive, to help for health promotion and preventive measures, to increase lifestyle intervention, vaccination, and screening services, and use the new technology and telepharmacy. So pharmacists will be have a very essential role in the aging process of old adults, and in a society will be more and more old. And I think that the course that we are managing, EAGG e-Trigger, can help pharmacists to gain a lot of knowledge in the new era of geriatric medicine. Thank you very much.
Thank you so much, Dr. Jean-Pierre, for this very engaging presentation. I would like to now introduce our next speaker, Dr. Ermira Krasniqi. Dr. Krasniqi is an associate professor at Amica Rezonanza in Kosovo. She holds dual PhDs in pharmaceutical and nutritional science. Her research focuses on vitamin D, genetics, sarcopenia, and medication use in aging populations, and she has numerous international publications. She advocates for personalized medicine and highlights data from understudied populations, empowering pharmacists to improve medicine use, prevention, and healthy aging. And she is a very proud member of the FIP academic pharmacy section. Dr. Krasniqi, thank you so much for being with us today. The floor is yours.
Thank you. Thank you for this presentation, and thank you to the previous speakers for their amazing discussion related to this issue. And I'm also very happy to be here to give as much as possible my contribution in this very important topic for the societies and for the future. As it was mentioned, I am pharmacist by background, but when I started and worked on nutritional sciences and physical and sarcopenia, I understood how multidisciplinarity this process is, and I started to see this process from different perspective. My work with older adults has yes, I'm sorry, just. Okay. My work with older adults has been focused on medication use, comorbidities, nutritional status, physical decline, and genetics. And this experience has shown me how deeply interconnected these factors are in shaping healthy aging, and that for some of them are within our control, while some of them we cannot do much, as it was mentioned before, like genetics. Today, so I'll discuss challenge of aging, what healthy aging means, and what is a pharmacist's role and tools, and some real-world examples. As you can see here, I have presented some data from World Bank, and I have just presented some cases. I presented worldwide situation, which is campaigned by developing countries and also developed countries, which in the next slide we will see that when we discuss healthy aging, it really there are really two different perspectives and two different current situation. And European Union, which is campaigned by states that have good, that are high-income countries, and that they started to work on this direction earlier than developing countries. And my country, which you can see that the change, this demographic change, is really high in the recent years. So according to United Nations projection in 2050, actually 1 in 6 people globally will be 65 years of age and older, while this dramatic shift underscores the urgency for the health system, especially in this case, as we are discussing, community pharmacy practice to adapt to an aging world. The challenge, in my opinion, and from what I've seen so far, the challenge is not just adding years to life, but it's also, the main thing is to add life to years, how it is say. So healthy aging means maintaining the ability to do the things we value, not just the necessarily the absence of disease. Just shortly from medical point of view, aging is an irreversible biological process associated with functional, psychological, and social changes. And it is shaped by internal factors like genetics, multimorbidity, body weight, inflammation. It was mentioned previously, and external factors such as inactivity, malnutrition, and socioeconomic status, which explains why pharmacists are uniquely placed on this crossroads. In my own research, I have found how in older adults, community dwelling older adults, just to point this out, because we're not talking about hospitalized people, but community dwelling older adults, we found that over 3 years of follow-up, there were a significant decline in muscle fitness, especially in chair stand and time up and go. These changes were influenced by genetic variants, showing that predisposition matters, but something that we cannot do much, unfortunately. And at the same time, nearly half of these participants were vitamin D deficient, and this was associated with a decline in muscular fitness. And in addition to this, 70% of them, even community dwelling, were on medication with 2.1 medication in average, and 56% rated their health status as not good, while 83% of them were overweight, and obese, which implies for a nutrition and nutrition counseling gap. So this is now relates to the fact that pharmacists can address these points, but I will not go into these details right now. So what are the global challenge here? The worldwide global challenge is polypharmacy. Studies show that around 30 to 40% of older adults are already in polypharmacy, meaning that they are taking more than 5 medications. And this is alongside diseases such as diabetes, cardiovascular diseases, osteoporosis, or frailty. Add to this the poor nutrition, social isolation, and low health literacy. And you see why accessible and trusted health professionals, like in this case pharmacists, are crucial. What are the key problems here? It is that clinical care is often fragmented, and pharmacists, as it was said before, are underused in prevention and early detection of these issues. So how can pharmacists do more to not just add years to life, but life to years? Yes. So pharmacists are often the first and sometimes the only health professional older adults see regularly. They can identify the risks on the medicines cabinet, ensure safe prescribing, and shift the focus from giving pills to supporting independence. An interesting study in 2019 checked for the medicines cabinet of 1,300 older patients and found that 40% of 40% kept expired medicines, while 20% had redundant prescription at home. Based on this, here I've just brought in very shortly, because I will discuss separately each of these components, how pharmacists can support healthy aging, and what are these components that are crucial and important. Of course, everything it was and it will always be the medication management, and also the ability to assess the patient's ability to adhere, which I will discuss later on, vaccination and prevention, mobility or physical activity, and nutrition counseling. Starting from medication management. Assessing so regular medication review, dispensing medication and knowledge, so teach patients proper use of medications are crucial to being successful and being sure that they will adhere to the medications, and this will directly impact the appropriateness of medication use, in the decrease of adverse effect, and also the medication cost of this treatment. But assessing the patient's ability to adhere to a medication by noticing certain impairment, like lack of hand strength or cognitive impairment or loss of vision, it's very crucial. In teaching patients how to take these certain medications, like inhalers or transdermal patches, or how to measure doses of, in case of, for example, liquid medication, is crucial to achieve this point in this case. But of course, we are talking now just from the pharmacist point of view. But this should be requires to be accompanied by a policy support, electronic health data, which are not regulated in every country worldwide. There are developing countries that still are facing some basic issues related to this important matter in this process. Then it is important that, except for the regular medication review, patients should be advised with respect to nutritional profile, with respect to physical activity, to keep themselves vital. I have interviewed around around 1,000 older people, myself, regarding medications and comorbidities and nutritional status and physical activity. And I've seen that the misinformation is really present, and it is very important for this information to be explained as much as possible, because in some cases I have faced myself also the idea of being pride to ask again, or not admitting that they are having like hearing issues or similar problems. So for example, what would be important is to advise them about protein intake and how protein intake is important for muscle mass loss, and how they can take those proteins. What are the foods that contain the right what are the right foods to take these proteins? Regarding vitamin D supplementation, regarding mineral supplementation, and as long as they are also dispensing these medications, the pharmacist is also available to know in which cases some vitamins cannot be given due to interactions between them. And this is also interconnected to the functional aging. A little bit of advice, as we will see later on, studies show how advice for physical activity has has increased the muscle fitness of these people in a short amount of time in the populations of these studies. It is very important for older people to understand that they should work in muscle strength, they should work in balance, and this will be key to the fall prevention strategies, which is related directly to their independence. And also, pharmacists being a frontline contact with these people is very important, that they have the chance to work on also psychosocial motivation. What are the gaps here? Pharmacists can help close these gaps, but of course we need better training and tools. Despite this potential, studies show that pharmacists are comfortable with medication, but less with nutrition, exercise, or adapting communication to cognitive and sensory changes in older age. This is exactly where, in my opinion, more training is needed. Closing these gaps requires curricular updates for future pharmacists and ongoing training for the pharmacists that are already working on their profession, and including modules on nutrition and physical performance, and also practical workshops can help pharmacists adapt communication to the need of older patients. These are some real-world examples of studies that really analyzed these issues. And in Japan, for example, pharmacists offering simple exercise advice improved functional performance in older adults, like improved in sit-to-stand performance, while another similar study found that pharmacists and dietitians together could screen malnutrition and improve dietary counseling in older people. Reclaiming, in the end, it's about reclaiming independence and quality of life, because as we said before, healthy aging is not just the absence of disease. Maintaining functionality and be able to do the things we want to do and we love to do is very important. So pharmacists should be considered the frontline for healthy aging, from prescription to independence, mobility, and well-being, because they have the chance to bridge medicines with other important preventive factors such as nutrition, physical activity, or the best communication. Even though today it's not the main discussion here, I think it should be said that AI is a great helper, but it's not a decision maker, because the responsibility always remains with the pharmacist. So I would like to finalize this presentation by asking from the community pharmacists to really try and look beyond the prescription. Thank you.
Thank you, Dr. Krasniqi, for this excellent presentation. I would like to now introduce our next speaker, Dr. Rafaela da Silva. Dr. da Silva is Senior Scientific Project Manager at Health Science e-Training in Switzerland. She holds a diploma in pharmacy from the State University of Londrina in Brazil and has a PhD in pharmacology from the University of Zurich. She published over 50 scientific articles in prestigious international journals. She held the prior roles as Senior Scientific Project Manager and Head of the Master in Translational Medicine and Biomedical Entrepreneurship at the CITEM INSEL School. She also worked at EPFL and Guorgui Cardiovascular Institute in Finland as a scientist and as a visiting professor at the Department of Cardiology, Hôpitaux Universitaires de Genève, and as an associate professor at the Federal University of Minas Gerais in Brazil. In January 2023, she joined HSET as Senior Scientific Program Manager, and in this role, she is actively involved in the distance learning educational program in geriatric medicine and gerontology. Since October 2023, she also works as an e-learning consultant for the distance learning Portuguese courses at the World Intellectual Property Organization. Dr. da Silva, thank you so much for being with us today, and I will now turn it over to you.
Thank you very much. Thanks for the opportunity to be here today and share with this community of pharmacists a little bit about our program. So good morning, good afternoon, and good evening. I see participants from all over the globe, and I'm happy to be here with you all. Excuse me, I don't see the presentation screen. Oh yeah, good, thank you. Good. So just as a little bit of the global context, I think it's a bit redundant. Everybody has a little bit spoke about it. So we know all that by 2050, 1 in 6 people worldwide will be over 65. So older adults face multimorbidity, polypharmacy, frailty, and social changes. And the WHO strategy 2026-2030 promoting functional ability and person-centered care. So pharmacists are key in bringing medicine's expertise with healthy aging goal. Health aging and pharmacists, the evolving roles. Professor Michel has very nicely presented the updated definition of health aging, where functional ability to be and to do what one values. So the role of pharmacists, it can be in preventive strategies, implementation of vaccination, screenings, support self-care initiatives, physiological change, so age-related changes affect drug metabolism, requiring specialized knowledge for proper dosing. And optimized medicine use can reduce risk associated with polypharmacy and adverse drug reactions. So all these require practical and evidence-based tool. So to introduce the e-trigger, e-trigger stands for electronic training in geriatrics and gerontology. So it was created by the International Association of Gerontology and Geriatrics, which is a global organization dedicated to promote gerontological research and training, and the Federation of Geriatric Education, FGE, focus on addressing educational gaps in geriatrics care worldwide. In 2017, Professor John Rowe in the IAGG World Congress established this training, and it was annually taken in this conference. However, in 2020, with the COVID epidemic, so the course was transformed. The idea was to transform the programming fully online. So the e-trigger joined the Health Science e-Train Foundation, a foundation, a Swiss non-profit organization that works with training and education. And in 2021, a partnership was established, And the course was running first in Asia and Oceania in 2020. And this program continues in 2023, a cohort in 2024, and this year in 2025. So it's a year program. So in 2023, we launched a similar program in a different time zone, which is Africa, Middle East, and Europe. And now in October, we are with the second cohort finishing, graduating, and we now launched the 2025-2026 course for this region. In 2026, we will launch similar program in a third time zone, which is Latin and North America. So we have awarded already 139 certificates in Asia and Oceania, and 185 certificates in Africa, Middle East, in Europe. And currently we have 90 participants in Asia program and 189 in this AFME, African Middle East. So as an overview, this program is an innovative online education program where it consists of 12 monthly sessions, and it has 3 hours each, covering primary geriatric medicine and gerontology topics. It is open to healthcare professionals from all backgrounds working with older adults. It has an interactive case-based learning. It is culturally adapted content because we have very different scenarios in different countries and regions that is part of the program. We have team activities where enable students from a similar zone speak on their own language and then bring the case for the trainees, and has a potential for data publication. When they bring their local data, we support them to elaborate a scientific report on their data. And the program is a total of 60 hours for the year certificate. And there's a possibility to do a standalone session. So you choose the session you are interested and perform the session. This would be 3 hours plus 1 quiz. So it would be a certificate of 4 hours. Again, the session is composed of 3 hours and divided in 3 blocks with a little bit different topics. So we have for each topic a keynote speaker, 1 case report presentation by a scholar, which is a more experienced trainee. And we have then after open discussion on the topic. So after the attendance, you get your certificate. And after the 12 months course, you also get a different certificate. The program uses the Moodle as e-learning platform. Is a very friendly and common use platform, very intuitive, where they get information monthly about the sessions. So you have your folders that opens monthly, where when you click inside, you have the content related to this session. So you have information about the program, you have information about the speakers, and some reading materials. Here are some examples of sessions for the new course that will start in October. This course will take place on Thursdays afternoon, again, 1 Thursday per month. And this is an example of topic. For example, the first session will be in International Policies on Aging. That will be 23rd of October. Then session 2 in November will be Prevention Strategy in Older Adults. Third session will be Muscle Health Matters. So sarcopenia, frailty, interaction between muscles and bone. Then in session 6, we will talk about gerontopharmacology and medication management. So a bit revision on pharmacokinetics, pharmacodynamics, clinical concepts of inappropriate medication use. So session 11, I think, can be interesting also for pharmacists. We have the life course perspective on mental health. And the last session of the course will be in technology changes and older adults care. So for the different program that we have for the Asia Oceania, we are going to start now the session 10. The course will finish at the end of the year. And I would like to invite you all, if you want to participate without any commitment. So please send a message to me, an email, and I will send you the Zoom link. You can make a visit, attend this session without any commitment, just to understand how the sessions work, if would be of your interest. So in this session, we will be talking about the control to fight against healthcare associated infections, vaccine preventable respiratory diseases, and HIV. So why e-trigger could be valuable for pharmacists? We think these programs are accessible, so it's online, it's flexible learning format. If you are not able to attend the session, you can watch the recordings on your pace, even though we recommend to attend because it's very interactive. It's practical because we have case-based learning with decision support, checklists for immediate application. It is interdisciplinary. We have nurses, we have medical doctors, GPs, geriatricians, we have nutritionists, dentists. It's really very interdisciplinary. It is empowering, so supports expanded roles in prevention, deprescribing, and medication adherence. I think the program aligns with the FIP and the global goals. It supports the 2018 FIP policy, the WHO Health Aging for the decade 2021-2030 initiatives, equity and access. So it promotes equitable, safe medication access across global communities. So we believe that e-trigger facilitates the transformation of the pharmacy workforce to meet evolving global needs, health needs. I mean, not only pharmacists, but the health professionals. So the next steps, so it's expand the training, so e-trigger across FIP networks globally, integrate into the continuous professional development requirements, and strengthen the partnerships, so collaborate with universities and practice sites for implementation, and to position pharmacists as leaders, so establish pharmacists as health aging champions worldwide. So here, if you would like to know more, so you can go on our website. So again, the program for the Africa, Middle East, Europe region starts in October, so it's Thursdays afternoons. Asia Oceania is on Saturdays. So we are by the end of the course, and in January, we'll start a new cohort. So this course has the FIP seal, and we are proud to collaborate with FIP. So thank you for your attention. So if you want to get some information about prices, so it depends on the annual income of your country. So you have low, middle, and high income country, and also specific prices for the standalone sessions. So thank you for your attention.
Thank you so much, Dr. Da Silva, for this very informative session. And thank you again to all our speakers for the really, really great and excellent presentations, and for sharing your valuable expertise and insights on this important topic. I know I was taking a lot of notes as you were speaking, not necessarily from my capacity as a pharmacist, but as an aging person as well. So I think there was a lot of things to learn from. So I'm sure that there are a lot of questions from our colleagues. So we'll now open the floor for your Q&As. Again, just a reminder that if you have a question, please insert it and write it in the question box, and we will make sure to get to it. And I already see that we do have some questions here. So maybe we can start, maybe just building on the last topic about the e-trigger program. And Rafaela, you did address the cost, but there are a couple of other questions related to it. Are there any plans to launch the e-trigger in the Caribbean, as we have a large aging population. And I think you did get another affirmation there that you already have someone who wants to join the course.
Thank you. Yeah, I send you the link for the course. I just see online here that we have some trainees that are attending this course, but there are, I see Kledja, that she's very active in she did twice, because you can do, it's not the same content. So some people do 1 year and then they do a second year because it's complementary. And for the Caribbean, yes, so the LANAN, we say Latin, but it's Central America included, so it will be available for the Caribbean. We do not have a date. Professor Michel, can you say the most optimistic timing for the launch?
Beginning of April 2026 or May 2026.
Will be available in the FIP website for sure.
Yeah,
Thank
perfect. You. And can you clarify, is this accredited?
So the program is accredited by the International Association of Geriatrics and Gerontology. It is accredited by FIP, but as previously was said here in the chat, the points that it's accredited depending on the country. So you get your certificate with this amount of hours, you will get points for the continuous education in your country. It is accredited by FIP and IAGG.
Perfect. Thank you.
Thank you.
I see there was a question here about the cost, but you already addressed that in your presentation. Just going to some of the other questions that are in the Q&A box. I think this question was during Dr. Krasniqi's presentation. Is there any tools you use to assess medication adherence for older people?
Yes, thank you for the question. Now, it depends if we're talking locally or globally. If we are talking locally, no, there is no tool in the countries that I've been engaged. There were no specific tool that help pharmacists to address these points of interest. I think that this is exactly where I believe it should be done more, to also with engagement of policymakers to facilitate and develop a healthy aging pharmacy toolkit that may include a clear guideline and practical protocol on how to conduct medication review, and also provide nutrition counseling and deliver exercise or fall prevention advice. There are tools that have been studied worldwide, like Stop and Start, but not specific tools for community pharmacists.
Perfect. Thank you so much. Maybe if I can just go to Dr. Jan. We started the webinar today with a presentation, and from your perspective, how do you see pharmacists contributing to healthy aging within their communities, and not from necessarily a vision perspective, but from actual actions that can be implemented?
Thank you very much, Sherif, for these questions, and thank you to all my panelists for the very stimulating presentations and discussion. I think we can be very clear that pharmacists are the most underutilized professions in our health and care system, despite being so trusted and accessible in the communities. And what I'm thinking about how we can work better, I think we need to take a more systematic approach. And certainly for us at WHO at the global and regional level, we have the global network of age-friendly cities and communities, and we have the regional network of healthy cities. And all of them also have national networks. And the reason why working with cities is because we see the implementations. But then as more and more cities are moving towards this age-friendly movement, we see the need for national programs. For example, in Wales, we have national programs, and this will help to work better to support all of the local communities. And I think this is a way perhaps we can link up those national network and national programs with the national associations, with pharmacists, so that we can sort of better support the local communities. And I think this is perhaps one way we can do that. But I'm quite curious to also hear from our colleagues and participants to flip the questions back to you. How can we support you to ensure that your voices is at the table? How can we work better together?
I think that's a very good way to put it, and because at the end of the day, collaboration is key here, and obviously this has to be an ongoing work that needs to be done. And so certainly for everyone who is attending today, we want to make sure to keep the conversation going, and we welcome you to be engaged after the webinar. And if you have any questions or if you would like to collaborate on any initiatives, please do connect with us, and we'll make sure to get back to you. For Dr. Jean-Pierre, when discussing preventive measures, which ages do you think are the most important to consider?
Thank you very much for this question, which is very important for me. I think that the first part of life is extremely important, but another one which is completely neglected is the midlife. And I think that at midlife, you have the chance to know if the people will age easily or if they will have any problem, medical problem. I think that it is midlife that is very crucial. And then later, indeed, you can do a lot of preventive measures. But I think that midlife is really essential to help people to age better and longer.
I think that's a very, very important point. I hope I'm still about really that
You are
point.
May I compliment Dr.
Absolutely.
Jean-Pierre? I think this is a really, really excellent questions, but I think we have to frame it differently as well, because it's not about investing one or the other. And I think that's why the life course perspective is important. I think we can all agree early investment in childhood or even maternal health is key to healthy aging, but that doesn't mean that we don't invest for midlife and older persons, which are often under, there's less investment in prevention. And there are clear evidence and research about investment at every stage of life. And I think it also is the right based approach as we think about towards the UN Conventions on the Rights of Older Persons, that there are things that we can do to improve functional abilities so that older persons who have spent a lifetime of contributions to the communities can continue to function. And I think this is where the message comes in about changing this narrative about investing for all, rather than trying to say, how can we best do it? But there are evidence about at each stage of life, there are key investment that we can work together. And this is part of the strategy about how we can create strategic investments and understanding the social return on investments, what we can do together.
I think that's a very, very good point. Thank you, Dr. Yang. In looking at one of the questions in the Q&A box here, there is a pharmacist who is interested in healthy aging and participating in various community initiatives and would like to see how to be more involved with government stakeholders and entities. So maybe for Dr. Krasniqi, from your perspective, how can policymakers and health systems support pharmacists in doing this work and moving beyond the dispensing to becoming active players in promoting healthy aging?
Yes, thank you. Thank you for the question. Actually, it relates to what I discussed previously with one of the questions. Because at first, governments should invest in electronic health records, especially in the countries where it's not done. Maybe it's a surprise to hear for really high income countries, but there are lots of countries worldwide that are dealing with this issue, because you see, as a pharmacist, you address an issue, but you need to write it somewhere. It needs to be somewhere documented. So investment in electronic health reports and better integration into primary care teams is also a key. To ensure that the pharmacists can use their accessibility to improve prevention, reduce medication risk, and support functional aging. And also, policymakers should facilitate the develop of healthy kids, healthy aging, promoting kids, toolkits that would be somehow universal to community pharmacists. And to combine this with maybe reimbursement scheme or training modules and toolkits ensures pharmacists to achieve these goals, because we are always discussing this from what the pharmacists can do, what the community pharmacists can do, but we need to the same work on how to support pharmacists to achieve these goals.
Perfect. Thank you so much.
You're
And
welcome.
when I look at the presentations, and again, there was a lot of great information there. I see some of the takeaway messages that I've noted that we're not an aging population. We are, in fact, an aged population, and that aging is living, and that prevention is the cornerstone of healthy aging and healthy living. I think also one of the things that resonated with me that healthy aging is not just about the absence of disease, but it is about maintaining functionality and being able to do the things we love, and that it's very important to create environments and healthcare systems where everyone can age with dignity and to adopt healthy lifestyle and healthy behavior at midlife. And obviously that pharmacists have an important role to play as the trusted first point of contact and the link between patients and the various components of the healthcare systems. And they have an important role to play in health promotion, preventative measures, lifestyle interventions, vaccination, screening, medication management, and counseling. So there were a lot of great messages here. And I think that for me personally, I think I may go back and listen to this webinar again. And if you would like to do that, or if you want to invite a colleague to listen to the webinar again, please do so at FIP events.fip.org. All our events are listed there. The recording will be made available on the website and also on YouTube as well. And while you're there, please check out our upcoming events and make sure to register to attend them as well. And as I said at the beginning, this is the first of 3 webinars that FIP is organizing on the role of pharmacists in the care of older persons. The next 2 events are on October 9 and October 29. So please mark your calendars and make sure to register for those events, again, at events.fip.org. It is hard to believe that the Copenhagen Congress is already behind us, but now work is underway for the next Congress in Montreal, Canada, which is supported by the Canadian Pharmacists Association. The Congress will be held from August 30th to September 2nd, so please mark your calendars. And also some other important dates to keep in mind. The abstract submission deadline is March 18, 2026. The early registration fee deadline is June 3rd, and the second registration deadline is August 12th. I promise you this will be a fantastic Congress. The FIP Congress is always a great opportunity to network with colleagues from around the world and also to learn and share best practices. So do hope that you'll be able to join us, and certainly look forward to welcoming you there. And with that, we are now at the end of our event. Again, I want to thank our fantastic speakers. Just a great work and very engaging presentations, each of you. And thank you for making the time and for being here to share your expertise. Very valuable. And also want to thank the amazing FIP team, Ines and Albena, for the great support as always. And thank you all for making the time to join us today. Hope you enjoyed the webinar and wish you a great rest of your day. And we'll see you at the next event. Thank you.